Okay, hello everyone. My name is Alabi Deborah and I'm here to give a PowerPoint presentation on the device I'm trying to sell. Hello everyone, so thank you for joining me today. I'm excited to present Alabi Medical Company, where we are at the forefront of innovating healthcare through advanced medical devices. And today we'll discuss on one of our flagship products, the pacemaker. A pacemaker is a small battery-powered device that plays a very big and crucial role in managing heart rhythms, which means how the heart beats, the diastole and the diastole. The pacemaker helps in making sure it goes the right way and the right part. It prevents it from beating too slowly, ensure that it maintains a healthy pace, and the device is surgically implanted under the skin near the collarbone, so it's not something that can be done probably intravenously. It involves cutting and going under the knife, which is surgically to implant it, and it's also known as the cardiac pacing device, which is, and our mission at Alabi Medical is to enhance patient outcomes and improve quality of life through cutting-edge technology. And then we move on to the second slide, which now dives into the different types of pacemaker my company has to offer. First one, we have the single chamber pacemaker. This device uses one lead in either the upper or lower chamber of the heart. And then secondly, we have the dual chamber pacemaker. This type utilizes one lead in the upper chamber and another in the lower chamber, allowing for more coordinated heartbeats. And thirdly, we have the biventricular pacemaker. This advanced device uses three leads placed in the right atrium, the right ventricle, and left ventricle to synchronize heart contraction, and allows it that it has an equal number of diastole and systole, not irregular heartbeats, which is particularly beneficial for people with heart failure. This type is usually used for people who probably their hearts can't function properly anymore, and totally the heart can't work properly, and it is used for them with with people with heart failure. And also down below in the images here, we have the two types of models. We have the model A and the model B. The model A is an innovative wireless connection which enables real-time data sharing, enhancing patient monitoring, and reduces hospital visits. And also for the second one, we have the extended longevity, which is up to 15 years for the device to work, which shows how long it works for. And also we have our which shows how long it's going to work for. And then for our B model, we have advanced monitoring system, which provides continuous heart rhythm analysis, which means it updates you continuously on how your heart is working and performing efficiently. And also, it also has a wireless connectivity, which allows you to connect it to Wi-Fi and different aspects of your phone, laptops, and to monitor how your heart beats on different devices. And also, model B prioritizes patient's comfort, ensuring that post-implantation and after post-implantation you're able to maintain an active lifestyle, which allows you to enable you to do activities or anything you want to do without any restriction or liability to yourself. And also up here we have all the types of pacemakers that are being placed into the parts of a person, which includes a battery, the pacemaker generator, and then the three different types of pacemaker being involved in placing it into the body. And then we move on to our fourth slide. Our third slide we discusses the key benefits of our pacemaker. One is enhanced patient comfort. Our pacemakers are designed to provide maximum comfort, allowing patients to lead a normal life without discomfort. And two, we have long-lasting battery life, which is engineered for reliability. Pacemakers offer a long-lasting battery, reducing the need for frequent replacement. Long-lasting battery of about 15 years, which makes the person not to need constant changing of the battery, maybe every 5 years or every 6 years. But for 15 years, you kind of that particular pacemaker in your heart without bothering or having to change it consistently. And also advanced technology features, which is incorporating the latest technology. Our devices ensure accurate monitoring and seamless integration with healthcare system. So it uses top of the line technological tools to allow proper equipment and tools are used and going to be placed to the body. And in the image here on the benefits, we have the leads, which are wires that send impulses from the pulse generator to the heart muscle, as well as sense the heart electrical activities. So those wires are the one that help to contract, that helps the pulse generator, which houses the battery of the contraction and the relaxing of the heart. And the pacemaker may have 1 to 3 leads to treat your heart problem. So 3 leads is used for those who probably have heart failure and their hearts can't really function properly. But those with 1 are not as bad as those who use 3 leads in their pacemakers. Yes. And then after this, we move on to the fourth slide, which discusses about Alabi's medical company, which is its logo is innovative solution for better heart health. As Alabi Medical Company, our mission is clear: to provide innovative solutions for better heart health. Recognize the growing need for effective heart health management, especially as cardiovascular diseases continue to rise in the recent years. Because in recent years, the demand and the market for pacemaker have significantly increased due to the rising prevalence of cardiovascular diseases. Because as of 2016, it was estimated that there were about 1.14 million pacemakers globally, and by 2023, which was about 2 years ago, that number had increased to 1.43 million units. The increasing prevalence of heart disease necessitates innovative solutions like our pacemakers, with projections indicating a significant rise in the elderly population. The demand for pacemaker is expected to escalate, which means it's expected to increase, highlighting urgent healthcare need. But also, it will be necessary for people to reduce things that lead to getting a pacemaker, like probably eating too much fat and excess fat can lead to heart disease, which can cause heart failure, and also too much stress. So it's important to get enough rest, enough of everything, enough rest to reduce the probability of having heart disease. And after this, we move on to the development process. And our development process is thorough and meticulous. Thorough in the process, thorough analysis, a comprehensive analysis of medical needs and technological advancement is made to ensure that the proper type of analysis and needs are met in the market today. Also, prototypes are being made to ensure that the quality and effectiveness. Prototypes of different LEDs and generator are being brought together to ensure which LED and generator are compatible and can carry on for a long lasting time. We don't want a device that is placing somebody and probably causes more harm than good for that individual or for that person. And then we have rigorous testing. Yes, it's conducted on lots of people with real patients to ensure the standard is met and the patients come back with good reports and efficiency of the device. Also, strategic launch. We make sure we strategically launch it during process and during with professional people involved to allow for proper education and proper understanding of the devices we are giving to people. And also, we move on to the next slide, which involves the image of a pacemaker. And our pacemaker provides unmatched reliability and enhances the quality of life for patients. With advanced technology and exceptional patient feedback, our devices are trusted by healthcare professionals worldwide. One, we have unmatched device reliability, which is a 99.9% success rate, which ensures consistent performance and safety for patients in diverse clinical environments, because everyone has an equal amount of clinical environment to ensure it's equal for everyone in different clinical environments. And exceptional patient satisfaction. We ensure that patients are satisfied and are not exasperated, meaning they are not frustrated or irritated when it doesn't work as expected. Make sure it works as expected to work. We also have innovative monitoring features, which is wireless, which allows your ability to monitor it on different devices, maybe phone or tablets or computers, without having to be there physically or staring at something to monitor. You can monitor it wirelessly. And after this, we move on to the next slide, which is pacemakers are life-changing technologies that address various heart rhythm disorder, including fast and slow heartbeats. And here on my right-hand side, I have a comment we made by a Dr. Samantha, a cardiologist at City Hospital, which says this is a life-changing technology and she can't believe that the difference it made. And also after this, we have Q&A sections, which allows people and individuals to ask questions based on what they think can improve the device, or maybe information that they would like to know or their doubts about the devices. Also, in the Q&A section, we clarify product features, engaging in detailed discussion about pacemaker functionalities, including the battery life and monitoring capabilities to ensure audience understand what we are talking about. Also, we explore market dynamics, which is we analyze the rising demand of pacemakers because due to heart disease prevalence, a lot of people need to understand and addressing the healthcare challenges. And three, we gather audience feedback. Through audience feedback regarding Alabi's products, fostering a collaborative environment for continuous improvement. We foster a collaborative environment to allow for continuous improvement in people and everyone around that area. And also, after this, we have a slide which shows us, join us in transforming healthcare with innovation at Alabi Medical Shout out for medical revolution. And the next slide we have, if you have information want to reach in us, you have information how you can reach us through the email and the social media platform and the phones. And also we should make sure we take care of our health as individuals, because we only have one life to live, and make sure we live it by doing what is best for our health. And also we also like to make pacemakers more accessible to people, because not everyone has enough money to get pacemakers, and not a lot of people live in well-built areas to be able to access pacemaker, and not everyone has enough money to buy it. So also include to make sure it's affordable for people of all classes and of all caliber. So thank you for your attention, and I look forward to hearing more from all of you. So sharing from here, all of you. And on my light side here, I have the references used, which involve key and Cork references like Mayo Clinic, which is a well-known medical platform for information on pacemakers, and Cleveland Clinic as well for more information on how pacemakers